Thank you, Mr. Speaker. You all have to bear with me today. I'm losing my voice, but thank you for the opportunity to present House Bill 370 today. It's patient transparency in dental benefits. This is based on NCOIL model language primarily. It deals with network leasing, virtual credit cards, and prior authorization. There's also some cleanup language for existing statute language. There is a committee sub. Mr. Speaker, if you'd have the clerk report House Committee Sub 1.
Clerk, please report.
House Committee Substitute 1 to House Bill 370.
Gentleman from Laurel.
Thank you, Mr. Speaker. House Committee Sub 1, we worked with Delta Dental. They took some issues with the bill. We removed assignment of benefit language. That worked for them. We also worked with Anthem, and under network leasing, it states that the insurer must keep a list of all third parties in existence in a list on its internet website. We compromised with them to update the list every 60 days instead of 90 days. And then also at the request of Anthem, we deleted those provisions that apply to 17A of the insurance code, and so this bill only applies to 17C. If there's any questions, I'd be happy to explain. Otherwise, I would move adoption of House Committee Sub 1.
Motion is for the adoption of House Committee Substitute 1. Is there any discussion? Seeing none, those in favor signify by voting aye. Those opposed, nay. House Committee Substitute 1 is adopted. Gentleman from Laurel.
Mr. Speaker, there's also a House floor amendment on this bill. It is here. It is just a technical correction. It is literally deleting one line. I would have the clerk report House Floor Amendment 1.
Clerk, please report.
House Floor Amendment 1 to House Bill 370.
Gentleman from Laurel.
Move adoption.
Motions for the adoption of House Floor Amendment 1. Is there any discussion? Seeing none, those in favor signify by voting aye. Those opposed, nay. House Floor Amendment 1 is adopted. Gentleman from Laurel.
Thank you, Mr. Speaker. Going into the bill by section, Section 2 covers network leasing. Many of you have probably heard from your dentist on this bill. Insurance companies can sell or lease dentists to different insurance networks without the dentist's knowledge or consent, significantly impacting the insurance benefits available to their patients. This erodes patient and dentist trust, which can lead to assumptions in treatment plans and costs based on a false understanding of the patient coverage. My bill, House Bill 370, would permit a contracting entity to grant a third-party access to a provider network contract or provider dental services or contractual discounts provided pursuant to a provider network contract if certain requirements are met. Next, it also applies to prior authorization. Again, we worked with language with Anthem on this. House Bill 370 seeks to prohibit dental carriers from denying, revoking, limiting, conditioning, or otherwise restricting pre-approved dental care claims or claims involved in the prior authorizations. The intent of proposed legislation is to ensure carriers honor the commitment provided in prior authorizations when there are no extenuating circumstances. Lastly, virtual credit cards. House Bill 370 prohibits dental benefit plans from restricting the methods of payment from the dental benefit plans or the vendor of the health and maintenance organization to the dentist, in which the only acceptable payment method is a credit card payment. So there are transaction fees dealing with virtual cards, some all the way up to 5%. Of course, this erodes the profit of the dentist. Lastly, in this bill, which is not in COIL language, is non-covered services cleanup language. House Bill 370 would permit the provider to charge his or her usual and customary fee when a service is not covered under the patient's insurance policy. This legislation would prohibit dental benefit plans from interfering when a contracted dentist agrees to furnish a non-planned service privately to a patient who knows the service is not covered by his or her plan. Mr. Speaker, that is the bill. I would be happy to answer any questions. Otherwise, I would move for passage of House Bill 370 as amended by House Committee Sub 1 and House Floor Amendment 1.